Welcome, everyone. We will give it just another moment as people are being allowed into the meeting room. All right, let's get started. Thank you, everyone, for joining us. First of all, I just wanted to note that we are celebrating 10 years as a Department of Public Health at NDSU. And we're looking forward to continuing to celebrate that through the rest of this year. We have some great resources on our website and Facebook, and we'll share that information, how to reach out to us at the end of the presentation. And next slide, Lauren. So today, thank you for joining us. We are going to be learning about reports from the field, public health nutritionists making an impact. We're going to be focused on MPH alumni who are trained nutritionists and how they're applying their training in their work as public health professionals. And our session today will be moderated by Dr. Mary Larson. Dr. Larson is an associate professor within the NDSU Department of Public Health. She has 30 years of professional experience divided between public health, healthcare, and higher education administration, teaching, and research. Before we begin, I'd like to do a NDSU land acknowledgement. We collectively acknowledge that we gather at NDSU, a land-grant institution, on the traditional lands of the Oceti-Sakowin, Dakota, Lakota, Nakota, and Anishinaabe peoples, in addition to many diverse Indigenous peoples still connected to these lands. We honor with gratitude Mother Earth and the Indigenous peoples who have walked with her throughout generations. We will continue to learn how to live in unity with Mother Earth and build strong, mutually beneficial, trusting relationships with Indigenous peoples of our region. And I'd like to turn it over to Dr. Larson.
Thank you, Ramona. And good morning, everyone, and welcome to our seminar, Reports from the Field, Public Health Nutritionists Having an Impact. And we have 5 speakers today who will share a brief synopsis of their work in public health. And because we have 5 speakers, I will introduce each of them before they present. And if you have any questions, please submit them in the chat. Hopefully we'll have a few minutes at the end to take a question or two. Before we begin, you might be wondering, what is a public health nutritionist? Well, a public health nutritionist is an expert in nutrition science who works to improve population health through the use of evidence-based approaches. They're registered dietitians, and they focus on assessing needs, planning, implementing, and evaluating strategies at the federal, state, and community levels. And their purpose really is to improve dietary intake and nutritional health of the population. And then through that, have a positive influence on population health and well-being. With that, I would like to introduce our first speaker, Alyssa Athman. Alyssa completed her Bachelor of Science in Dietetics and a minor in Wellness from NDSU in 2017 and earned a Master of Public Health specializing in Community Health Sciences in 2020. Alyssa took a semester-long break from the MPH to complete a dietetic internship at Iowa State University. Currently, Alyssa works as the Head Start Nutrition Coordinator for MAHUBE-OTWA Community Action Partnership in Detroit Lakes, serving low-income families across Minot, Hubbard, Becker, Otter Tail, and Wadena counties. So Alyssa, I'm gonna turn it over to you.
Thank you. Next slide, please. So like Dr. Larson said, I work for MAHUBE-OTWA Community Action Partnership, and MAHUBE-OTWA stands for the first 2 letters of the 5 primary counties that we serve. So Minot, Hubbard, Becker, Otter Tail, and Wadena counties, the dark purple section on the map. The light purple section are additional counties that we have services that we provide. And so on our website, it's an interactive map. If you were to click on Clay County, all the services that we offer within Clay County would pop up. For those of you who are not familiar with community action, it was created in 1964 to help fight the war on poverty. So it provides funds to operate programs and services to low-income families and individuals within communities. And at MAHUBE-OTWA specifically, we offer services in energy assistance and weatherization, childcare aware, family development, which could include housing, rent assistance, senior services, and right now tax services. We have a family health department, and then Head Start, which is what I work in. So next slide, please. Under the big MAHUBE-OTWA umbrella, I work in the Head Start department, and that's funded through the Department of Health and Human Services, both at the state and the federal level. So we receive grants from both. All of the Head Start services that our kids receive are free because it's an income-based program. So we provide childcare to children birth through 5 years old, in addition to expecting parents. And it helps them get ready for school and or give them a head start that they may not have had being in a low income bracket. We have 3 different program options that we can give families based on what their needs are. So we have preschool, which is ages 3 to 5. We have a home-based option where a home visitor comes into the home and provides education once a week. And we also have family childcare, which is like your daycare, in-home daycare. We serve about 500 kids across the 5 counties. And within Head Start, the main focus is early learning and development, health, and family well-being. Within like the scope of public health, all of our families are assigned a family coach to help them navigate any services that they may need. And they meet with them about twice a month. So they serve as basically an advocate for the family, and they check in, help them with anything. This could range from connections to other MAHUBE-OTWA services, if they need help on a college or a job application, getting insurance, connections to mental health services. If they need a ride to the grocery store, to a doctor's appointment, they help with transportation. They also complete parent trainings twice a month with all of their families. And so those could range from nutrition, first aid, budgeting, toothbrushing. We also, along with toothbrushing, we set up dental services for all of our families. And so we set up a dental office in one of our conference rooms. And just last week, we saw 75 kids and they all got free dental checkups and cleanings. And in the beginning of May, if they need treatment, they'll get free treatment as well. So lots of different services and programs within MAHUBE-OTWA and Head Start. Next slide, please. So my job as the nutrition coordinator is basically to oversee the Child and Adult Care Food Program, which is a federal assistance program that provides reimbursement for the meals and snacks that we serve to the kids while they're in our childcare. It is part of the Farm Bill, which is very public health related. So again, it's an income-based program, but our children, because they're enrolled in Head Start, they automatically qualify for free meals. So meals are not something that our families have to worry about paying for while their child is in our care. They will all get a breakfast, a lunch, and a PM snack. Because it's a federal program, we do have to follow certain meal and menu requirements. So that's the main part of my job, is making sure at the end of the month, all of the meals that we're claiming for reimbursement meet the certain menu requirements and meet the food component requirements. We are subject to a federal review. So we just had one in October. So I complete nutrition monitoring inspections for all of our classrooms in our 5 counties 3 times a year, and just make sure that they're following the program, and that if there is anything that we need to fix, we can get that fixed before we are subject to another review. Another large part of my job is following up on any nutrition concerns that families or even staff in the classroom notice. That could be weight, that could be looking at healthy meals, access to healthy meals, if a child needs additional connections with WIC, or if they need to talk to their primary care provider about a different formula to switch to because they're not tolerating the one that they're getting in childcare. We also have a lot of allergies, so allergy plans and dietary preference plans get created. We are required to accommodate all of those if they are considered a medical need. Next slide, please. So how does my job relate to public health? So at MAHUBE-OTWA, our mission statement is to help people achieve self-sufficiency. And if you've had a class with Dr. Larson, you've heard her say that we're trying to work ourselves out of a job. If we have everyone self-sufficient, they don't need any of the services that MAHUBE-OTWA provides, I would not have a job. Our director also says that we don't want to meet clients where they're at, we want to meet them where they dream. So figure out where their dreams are, where they want to be, but where they're at still, and figure out the barriers and how we can help eliminate those, help them overcome them, and connect them with the services that they may need. So that is my job. Next slide.
Yeah, that's fantastic. Thank you, Alyssa.
Thank you.
All right, we are going to our next speaker. Our next speaker is Erin Berentson. Erin received her Bachelor's of Science in Dietetics from the University of North Dakota and has been a licensed registered dietitian since 2013. Erin earned her MPH from NDSU in 2015 with a health promotion specialization. Erin has worked for the Department of Veterans Affairs, the Department of Defense at Minot Air Force Base, and as an outpatient dietitian. Erin joined NDSU Extension in Bottineau County as the Family and Community Wellness Extension Agent in 2019. Erin, turn it over to you.
Thanks, Mary. I appreciate the intro. I'm going to make sure I start my timer here so I stick to the task here. You can go ahead and go to the next slide and we'll jump right in. As Mary mentioned, I currently work for NDSU Extension up in Bottineau County. So you can see on the map right in the middle of North Dakota at the very top. And in case anyone's not familiar with Extension, I just want to do a little backstory. Every state has a land grant university, and ours in North Dakota is NDSU. And so really, I think the easiest way to summarize Extension is really the point of Extension is to really extend the research and the education that we find through and at NDSU to the people across the state. And it's really rooted in agriculture. My title, the Family and Community Wellness Agent, we love our acronyms, right? So we really focus a little bit on kind of community health programs, and that's kind of the best way to describe it. So that might include primarily nutrition and health education, but also big focus on food safety and mental health, leadership, community vitality, and, you know, really kind of encompassing all of those areas. And, you know, I think just the really unique thing about Extension is that it's unique in every county. It's different in every county. There's different staff, there's different positions. I know Sarah's on the call today too, and we have the same position title, but we maybe have different people in our offices and other roles. And so the really cool thing about that is we get to really focus on our local needs, because not only are our needs in North Dakota different from other states, but even county to county, we see a lot of differences in what the population's looking for. And so, you know, the really cool thing about Extension, and the reason we all love our jobs so much in Extension, you know, it's rooted totally in prevention. That's where our work is now. I like to think of our kind of FCW work as being very upstream. Again, we meet people where they're at. We give the education where they want it. You know, kind of like Alyssa was saying. And so we would love to work ourselves out of a job, right? But it's just fun. We get to do some really fun work. You can go to the next slide, please. I just wanted to share a little bit kind of how I got here, and it was fun. I'm really happy to share that I've genuinely loved every job I've ever had. And I think this is really cool. When I was working at the VA, it was when I was working through my MPH program. And I think really once I was able to finish my MPH, I was able to create this full-time position at the VA, and a very different organization, you know, and these government organizations are they just function so differently. And so I want to just focus on this because it's so interdisciplinary. I think, you know, the clinical world is really moving towards this interdisciplinary work, really understanding how the whole healthcare system impacts people, and, you know, their circumstances and experiences truly influence their health. And I think that's so evident in the VA. I would encourage anyone to volunteer, spend time, do internships, whatever it might be at the VA. I think it was such a valuable experience. And I think really kind of understanding the policy side of things in healthcare. And just from when I first started my MPH to when I finished, I could just tell how I was approaching my clients and my patients just shifts so much. So I just thought that was a really cool thing to point out. And then when I went to the Air Force Base, I literally applied, my position title was the Health Promotion Registered Dietitian. And I don't know how much more perfect that position title could be when I just finished my master's in health promotion, right? So that was a really cool balance of kind of seeing patients half time, but then doing, you know, all prevention work, cooking classes, and when working with people and keeping, you know, keeping our Air Force healthy, keeping them healthy, right? And so that was just a really cool observation, kind of going from the treatment side of things to then I was kind of half treatment, half prevention in that role. You can go to the next slide. When I left the Air Force Base, then I came to Extension, which is pretty much now all kind of in the prevention world. So it's just kind of this transition from treatment to prevention, and that's why I wanted to share that. But you know, Extension's so great. You know, we get to work with all ages and all demographics, but I really wanted to hit on the partnerships. Again, I know Sarah's going to talk more, so I hope we don't repeat too much of the similar stuff, but we partner with local agencies, local healthcare, other federal, state, and county offices and positions and groups. And so just a few examples of maybe some programs that we teach in a coordination with other organizations. The Diabetes Prevention Program, for example, is one that I offer in my county pretty regularly. And this is the national CDC's national program, right? This is offered all across the US, and Extension is really kind of the host or kind of the owner of the diabetes prevention program in our state, along with the Department of Health. And so, you know, we're able to partner with all these other organizations to offer those, and we can offer them all across the state, especially in our rural areas where maybe there's not a big hospital, maybe there's not a dietitian at the hospital, right? So that's been a really beneficial program that we're seeing in some of our areas. And I also have on here Stepping On. We don't do all just nutrition programs. Stepping On, for example, is a fall prevention program. It's an evidence-based program offered all across the United States. And so we partner with physical therapists and doctors and ophthalmologists, and we help keep our aging population, which we see in North Dakota, safe and healthy in their home where they want to be. We do a lot of programming in schools. We do a lot of just community-based education. So it's just really fun. A day in the life of Extension is different every single day. We create our own schedules. It's different in every county and every office. And so it's just really, really fun. You can go to the next slide. I wanted to just briefly touch on this for just a quick minute. Aside from my professional hat in Extension, I wanted to talk a little bit about my professional associations I'm involved with and how my MPH has really helped me in that area. I hold a couple volunteer positions on the, specifically with the North Dakota Academy of Nutrition Dietetics, which is just the professional associations for dietitians in our state. And I'm currently serving as the president in this role. And we've spent a lot of time in legislation, dealing with legislative issues, talking to our legislators, getting involved with our practice boards and lobbying. And so without that MPH experience and without that educational piece, man, I think I would have really been lost. And I think I would have been nervous about it. But really having that background education and understanding more of the big picture, you know, the whole policy piece and how that affects healthcare in America, period, is just so important. And so this has been something that's really kind of taken a big piece of my work lately. I'm actually going to DC tomorrow with Extension, but same things. I know Alyssa mentioned the Farm Bill. You know, we're talking to our legislators about the Farm Bill, and we're talking about the M&T Act and things that impact, you know, the programs that we offer here with other partners in our states. And so just really, really cool work. But I very much appreciate my learning from the MPH in this area, because wow, it's a lot sometimes. So it's been great. It's been a great learning experience. So that's all I have today. I know I'm going up on my time here, so thank you guys.
Thank you, Erin. It was fun to hear about a little bit about your journey, actually, too. So thanks for building in those other pieces. All right, our next speaker is Sarah Leidy. Sarah earned her Bachelor of Science in Dietetics in 2004 and a Master of Public Health with a specialization in Community Health Sciences in 2019 from NDSU. She is in her 16th year with NDSU Extension and has worked in a variety of roles, starting her career there with the Family Nutrition Program, which is North Dakota's SNAP education program. She currently works as an extension agent in family and community wellness and 4-H in Ramsey County. So Sarah, take it away.
Well, good. I'm glad to follow Erin. She gave us a good start on what extension does, and Erin and I are actually colleagues, so it's really fun to bounce ideas off of each other and occasionally work together on projects too. So next slide, please. So as you can see, I am in Ramsey County, pretty near Erin in Bottineau County, but like she said, you know, all counties do different things. We have different needs in our counties, so programming does look a little bit different. I also do a lot with our 4-H program. We have a booming 4-H program in Ramsey County, so I kind of wanted to talk a little bit about that as well. You move on to the next slide. So like Mary said, I did start my extension career with the Family Nutrition Program, and I really enjoyed that program. I worked with the Family Nutrition Program for about 12 years. And like she said, it is the SNAP Ed program for North Dakota. You probably otherwise know SNAP as food stamps. And it is a federally funded program and available in all states. And NDSU Extension is the host of this program in North Dakota. And then just what the program does is it helps the limited resource families make food decisions when they're at the grocery store or at the food pantry, and really to help stretch those food dollars. We help cook nutritious meals, prepare food safely with that food safety aspect, and then just throw in that healthy lifestyle, being active as well. This program reaches adults who could qualify programs. They don't necessarily have to be in the programs, but could qualify for programs such as WIC, the SNAP program, and TANF, Head Start, or even be on the free and reduced price meals at schools as well. And really, we really want to make sure that we promote that the healthy choice is the easy choice for all of our participants in that program. So you can move on to the next slide. So moving on to my FCW career, much like Erin, there's a lot of different programs that we have to offer, and because we are dietitians, we can kind of roll with that. In a lot of my programming, I do like to promote health and nutrition and add it into all the programs. Just a taste of some of my favorite programs that I like to work with. Smarter Lunchrooms is one that we've promoted a lot here in Ramsey County. It's actually out of Cornell University, and there are a number of agents in Extension that have been trained as technical assistance providers. And what we do is we offer trainings to our school lunch cooks and staff, and we provide that technical assistance to them. We have a scorecard. We'll go in, do a pre and a post scorecard, and just offer assistance throughout the school year. And to the right, you can see there's a salad bar from one of our participating schools. They not only were able to purchase their first salad bar a few years ago, but they also included some of the smarter lunchroom techniques in it. They added the fun names and pictures to the salad bar, like the X-ray vision carrots and Popeye's pick. And they even said that the kids were having more fun picking the healthy foods on the salad bar, just because of the simple addition of those little cards. So just one of those techniques that you can add with the smarter lunchrooms. One thing we also do is we offer a grant called Junior Master Gardener Grant, and gardening, we try to add a little gardening component every year as well. We were able to add some raised beds to one of our new parks in the community, and a local daycare was able to plant the gardens and learn about gardening and do some taste testing and things like that. So this year we've submitted a few grants, so we're hoping to do some similar things with our a local library that's been interested in adding some gardens. We do have a lot of On the Move to Better Health youth programming that we offer in the schools, and cooking classes in the summers as well. And then Cooking 101, a lot of us work with our local food pantries as well. And right now I'm working with one of our food pantries and doing cooking classes, and it's just a really neat partnership because this food pantry, they've got a great staff that assist us, and participants of this class, they're even offering a cookware set to a lucky participant at the end of this class. So they've been super excited about that. Next slide. 4-H, if you're familiar with 4-H, Head, Heart, Hands, and Health are what 4-H stand for, and we try to promote that health aspect in 4-H. We offer some cooking classes, and here we brought in an elder of the Spirit Lake Reservation to teach corn drying techniques at one of our classes, and it was just a really interesting addition to one of our classes, and the kids learned a lot. And then we do also have a program called the Healthy 4-H Clubs, where our clubs are adding some healthy snack policies to their meetings, and having meetings at places where they can get some physical activity. So that is an option for some of our clubs to become a Healthy 4-H club. Next slide, please. And then, like Erin said, the MPH definitely makes us feel a little more comfortable in some of these leadership roles. So there are some leadership roles that, because of MPH, I've felt more comfortable in applying for and becoming a board member of some of our associations with NDSU Extension. And then I also have to throw a plug in there for one of my favorite memberships. It's the North Dakota Nutrition Council. So if anybody's looking for a place to network with people that are interested in more of the public health aspect of nutrition, the North Dakota Nutrition Council is a great way to learn more. So that is my time.
Thank you, Sarah. Wow, I love hearing even more about how, as a family and community wellness extension agent, you bring in and you integrate your nutrition expertise and nutrition background. That's really cool. Thank you. All right. So now we're going to hear from Melissa Reardon. Melissa earned undergraduate degrees in food and nutrition and corporate and community fitness, and is a registered dietitian. Prior to joining NDSU's Department of Public Health in 2014 as the Money Follows the Person Tribal Initiative Project Manager, Melissa spent over 21 years promoting health through various positions, including serving 14 years as the Director of Healthy North Dakota, which was a statewide collaborative that was established at the time by Governor John Hoeven. Melissa earned her MPH from NDSU with a specialization in American Indian Health in May of 2019. So welcome, Melissa.
Thanks, Mary. Good morning, everyone. Next slide. So my first job out of college after my graduation was as a non-traditional location with as a dietitian located in a local grocery store, Cashwise Foods in Fargo and Moorhead. And this was a very new position. And so it allowed me a lot of creativity, flexibility to really develop it into how I thought would be most helpful for our customers, as well as our staff within the supermarket system. And it also was the first time that I met Mary, and I started understanding the importance of networking and learning a little bit more about other nutrition programs in the community, because we would Mary would bring clients into the store. I also was able to teach cooking classes to all ages and help customers read food labels and do some general nutrition education. And I was able to go out and do presentations many times into schools, and that was a fantastic job. And my former spouse actually accepted a position in Bismarck at Cashwise Foods, was moving into the Bismarck market, and so Cashwise transferred me not as their community dietitian, but as their deli manager. And so I was able to utilize a lot of my skills from our food service side of our dietetic education in terms of food service management and safe food handling and so forth. However, my passion wasn't in retail food services in that environment. And so I took a risk and I left my full-time job with benefits to take a temporary position with which was then Med Center One Health System in Bismarck. And excuse me, there was 2 dietitians who were on back-to-back maternity leaves, excuse me. And so I was able to jump back into the clinical world, excuse me. Sorry about that. I was able to work in the clinical world with an amazing team there. And I really wanted to be able to stay on, and they wanted to keep me on, but there was a hiring freeze. And so I needed to leave that position. And shortly after that, I was, my former boss at Med Center phoned me and said she had been contacted by the director of the hospitality management program at United Tribes Technical College, and they were looking for someone to help teach in that program. And so I was very fortunate to land that position, and was able to work and teach and learn with my students. Loved that position as well. I really, in looking back at it, that was really probably when I was starting to recognize social determinants of health, but I didn't know what they were called. I just knew that there was a lot going on that impacted people's ability to live healthy lives. And so I would have stayed at United Tribes as long as I could. However, the funding there was becoming to be quite uncertain. And so I was only funded like semester to semester. And with a young family, I needed more security than that. So I applied for a position at the North Dakota Department of Health as their cardiovascular health program manager. And so I started there, and then worked with cardiovascular health programming. So again, more on the prevention side of things, and we're learning about the state public health system and the local public health system through the lens of cardiovascular health. And then I also, our school health program coordinator left, and so they gave me the school health program as well. And so I learned a bit more about focusing efforts within the school population. And then our tobacco prevention and control director left. And so I was asked to serve as the co-director of that program for a period of time. And so really stretched my world into tobacco prevention and control. And then shortly after that, Governor Hogan appointed a new state health officer by the name of Dr. Terry Dwelly. And they launched an initiative called Healthy North Dakota that Mary mentioned, and I was able to serve as the director there for many years. And Healthy North Dakota was really an exciting and fantastic job as well. I was able to work with advocates in public health from all different spectrums, whether it was our health disparities with our tribal nations, if it was worksite wellness, if it was our breastfeeding coalition, our school health, our early childhood program, wherever I was at, you just sense the energy and the passion of the people that were working in those areas. And so it was a blast. It was so much fun to learn about all those different aspects, to do the networking and try to identify opportunities where we could strategically work together, because our resources were limited, as we all know, in public health. And also during that time, I worked, as I mentioned, with Terry, and a week did not go by that he asked me, when are you going to get your MPH, Melissa? When are you going to get your DRPH? And I used to, laugh and say, hey, Terry, come on home with me and see how my life is at home, because I had 3 little ones by then. Plus I was working full time for Terry, which was very full and enriching. However, I just wasn't ready to start my MPH program. And then interestingly enough, Terry he's very much a proponent of public health education. And so he applied for a Bush Fellowship and received that. And he actually did a feasibility study about establishing public health education in North Dakota. And it's actually through his work that our MPH programs exist in North Dakota, both at UND and NDSU. And so shortly after the MPH program started at NDSU, the first director of the program, Dr. Don Warren, came to the North Dakota Department of Health, and he gave a presentation. And during that presentation, I knew where I needed to be and where area I needed to be working in. And that was with our American Indian population and indigenous peoples within the tribal nations. It was just one of those aha moments, and I get goosebumps every time I think about it because of my current role, which I'll talk about in just a minute. Healthy North Dakota, the funding there also kind of became a little precarious. And so I needed to make a decision for the security of financial security of my family. And so Meridian Blue Cross Healthcare Solutions in Fargo was hiring for a worksite wellness director. And I applied for that position. And so we moved to Fargo, my kids and I, and that position was exciting at first because it was the first time that this position was going to be housed in their human resources department. And during my interview, I remember my hiring VP, as I was describing and answering questions that she'd asked me, she was like, that's it. That's what I didn't know what I was missing, but that's what we need. That's what we need. Well, I was talking about public health strategies, systems, and environment and environmental changes and all that. And so that was kind of cool because I thought, okay, this is really going to be opportunity to kind of mold a new framework within a business, if you will, and then potentially replicate that out to other businesses in North Dakota. However, my hiring senior VP and then head of Blue Cross, both of them left. And so I was reassigned under someone who did not value public health, who did not value dietetics, did not value me. And so I was really looking for another position that was going to help fit that passion that had emerged for me when I heard Dr. Warren's presentation. And so fortunately, NDSU was hiring. Next slide, please. And I was fortunate enough to next slide, please. Thank you. I was hired as the Money Follows the Person Tribal Initiative Project Manager, and I am humbled to be able to work with friends and colleagues from Turtle Mountain Band of Chippewa, Standing Rock Sioux Tribe, and also Mandan Hidatsa Arikara Nation, currently working with a pilot project with the South segment there. And the goal of our initiative is to help tribal nations establish long-term services and supports within their tribal communities so that their elders and tribal members who have disabilities are able to stay in their tribal communities and don't have to move to urban centers to live in facilities. And so it's really been an amazing work. I've learned so much. I was able to recruit a couple of folks into our MPH program. And in addition to working within tribal nations within North Dakota, next slide, please. The Centers for Medicare and CMS has funded 4 other states to do Money Follows the Person Tribal Initiative. So we have Washington State, Minnesota, Wisconsin, Oklahoma, and us. And within those 5 states, there's more than 31 tribal nations working on different aspects of the tribal initiative. And through my public health work, I've found myself in many of our meetings utilizing a lot of our public health thinking and application, and helping shape some of the work that we do across the 5 states, because while each nation is sovereign within those state borders, there's some commonalities across the 5 states that we can work on together. And so being able to bring some unity to that has been quite rewarding, to say the least. So, and then the next slide, please. And in closing, I'd just like to leave you with this. People ask me how does it work? How do you do the work that you're doing? And when I look at this particular slide, it's one that Dawn had shared during that presentation. I used it during my master's program. You know, there's 21 years difference in the age of death in North Dakota, depending on if you're born as white or American Indian. And it's just wrong on so many levels. And so that is why I'm so fortunate that I'm able to be doing the work that I'm doing, and hopefully making an impact on these numbers and in those communities. So that's next slide. And I'm done.
Thank you, Melissa. Wow. It's actually kind of fun to hear your career journey, because I remember when we met at Cashwise, and I was bringing in groups of new Americans for grocery store tours, and yeah, that was just fantastic. And there's actually a song, a folk song, that I'm reminded of when I think of career journeys that sort of, you know, over time look maybe like the person might have been lost, right? And that's not the case. I'm not lost, I'm just exploring. So I love that. Very rich experiences. Thank you. And I am going to introduce our last speaker, but certainly not least, is Christy Rott. Christy completed a Bachelor of Science in Dietetics from NDSU in 2017 and is on track to graduate with her MPH from NDSU with a specialization in community health sciences this spring. Christy is a public health dietitian working mainly with the Minnesota Women, Infants, and Children's Program as the WIC coordinator for Polk, Norman, Monoman counties. Over the past 5 years of employment in public health, Christy has found that she loves working in public health and helping to build healthy communities. With that, I'll turn it over to Christy.
Hi, thank you, Mary. Yeah, so hi, I'm Christy Rott, working for Polk, Norman, Monoman Public Health. And I should say, so we share a CHB, or Community Health Board, with Polk County. So we have a Polk County Public Health, and we have a Norman Monoman Public Health, and we have a lot of programs that overlap. And for that, we get to reach so many more people, and we get to really pull resources from each other, and it's just a really great partnership. Next slide, please. Okay, so just a little bit about my background. As Mary said, I graduated from the Coordinated Dietetics program in 2017. And I will be completely honest and tell you guys that that public health and community health was not on my radar when I was in dietetics classes. I was very much like, I want to work clinical. I want to work in a hospital. That's what I want to do. And it was very tunnel vision for me. So my last semester, I completed 2 internships. The first one was at a hospital in Fargo, and I was so excited. And then when I got there, I just found that I didn't get to spend the time with patients that I wanted to. And the ones that I did get to talk to, I feel like didn't want to talk to me. So it was a very eye-opening experience. And I just felt like I wasn't making the impact that I wanted to make. So then my next internship was at Clay County Public Health in Moorhead. And that was a completely different experience for me. And I wasn't expecting it. Like the first day I was like, oh, this is where I belong. Like I just fell in love with it. I got to spend a lot more time with families. I got to really get a better grasp and understanding of what their concerns were, what their needs were, what did they want to work on. I had resources to give them. I could refer them to other programs. It was just a completely different experience. So then I knew, okay, this is what I want to do. When I was in the middle of my internship there, there was an opening that I had seen for Norman Minot Public Health. They were going to be hiring a wellness coordinator that was going to be working with the WIC program. And so I applied for that and was accepted for that role. And the 3 programs that I work on, work with, is our WIC program, was hired as the wellness coordinator. So it's employee wellness focused. And then our child and teen checkup program. And those are still the same programs that I work on today. And I will say, once I was hired, then I found out that I was their first dietitian that Norman Minot Public Health had hired. Before that, it was all nurses. So doing the WIC and working with a lot of our other programs. And it is rural public health, so nurses can wear more hats. So that kind of made sense to me, but I was very excited and to be the first dietitian that they had hired. And then with that, I also knew that I needed to expand a little bit and be able to do a broader scope. So I'm like, well, I'm going to go to grad school. What do I want to focus on? And community health and public health was where I wanted to be. So I applied and have been doing that part-time for the past 3 years. So I graduated in May. And I'm very excited to be able to start to integrate more of what I'm learning now into what I'm doing now. Next slide, please. Okay, so I'm just going to kind of go over the different programs that I work with. Like I said, Polk Norman Minot WIC is one of our CHB programs. So we cover WIC appointments for Polk County, Norman, and Minot. We have four WIC staff, sorry. All 4 of us are CLCs, and everybody has either some kind of nutrition or community health background. WIC is a supplemental nutrition program for pregnant, postpartum, women, infants, and children up until the age of 5. We focus a lot on breastfeeding promotion and do our best to support our breastfeeding moms, and then a lot of nutrition education. We went to EWIC about 3.5 years ago, which was really nice for our clients. Everything goes onto a card. They treat it like a debit card. They use as much or as little as they want to when they shop. And I feel like it helps reduce some of the stigma of using programs. So WIC provides healthy foods, nutrition education, health information. We do referrals for other programs. We also have interpreter services. So this is especially helpful with our Hispanic population, or like in our East Grand Forks location, it has a large Somali population. And so we really do rely on our interpreter services. Our WIC program is, you do have to meet income guidelines to participate in that program. So usually we go off medical assistant status. So I always tell clients, if you qualify for MA, qualify for S, but any of the other safety net programs, so like SNAP, free and reduced lunches, anything like that, they would qualify for WIC as well. And then we have been doing remote services for the past 2.5 years, since March of 2020. We've been remote, and we are just starting to go back to offering in person in May, and we're all very thrilled and excited about it to have kids in our office again. Next slide, please. And so these are the other 2 programs that I work with. So like I said, I focus on employee wellness within my county. So for our Norman County employees. So like keeping healthy snack options available for them. So I make sure all the break rooms are stocked with like veggies or, mixed nuts, things like that, that they can easy grab and go. I organize wellness activities. So whether it's walking, drinking water, employee picnics, things that not are only focusing on physical health, but also mental health and kind of staff bonding, and then there are things that we have, or I guess I've been approached to to try to implement. So like we upgraded our water stations, we got employee gym memberships for our employees. I guess it was something that they had before that had gone away and they wanted back. So our employees are really good advocates for themselves. And if there's something that they want, they let me know. And then I start the homework on it and have to present it to the board and see if it gets approved. But and then for our child and teen checkup program. So this is also based off medical assistant status. So if you qualify for MA, you qualify for child and teen checkups. So anybody in our counties that qualifies for medical assistance, and then it's children under the age of 21. They get pulled into our system, and that's who we focus our outreach on. So we do letters when a child is due for a well, and then we make sure that they have access to their provider. So we send out a provider list, we sent out a dental list. We do an initial call when they first get enrolled in the program to see if they lack any of these services and if they need help finding services in their area. And that really does open up the conversation of what else do you need? Sometimes it's, do you have a list for daycare providers? Do you know where I can find a local food shop? How do I sign up for SNAP? It's things like that. So other community resources. And that's kind of what I do in a nutshell.
Fantastic. Thank you, Christy. Let's go ahead and show gratitude, give a round of applause in any way you can. I know I'll use my reaction button here. So thank you very much for to each of you. And one of the things that I just want to kind of encapsulate is that we collectively, with the 5 speakers today, we have 55 years of collective experience in public health nutrition. And it ranges everything from Head Start and child and adult care food programs, SNAP Ed, supplemental nutrition assistance program education, the diabetes prevention program, 4-H, women, infants, and children, child and teen checkups, family and community extension agents, community wellness extension agents, the Department of Health, different roles. It's just fantastic. What a rich representation of public health nutrition. Thank you so much. We do have one question already in the chat. I'm going to go ahead and read out here. What advice? This is from Dr. Huseth. What advice would you give to current students and recent graduates of the MPH program who are interested in public health nutrition in these areas that you're speaking about? Any one of you could unmute. Melissa, okay.
I would encourage them to just be open to new experiences and to try things maybe that they didn't have in mind. As you heard Christy's story and you heard a little bit about my story, you might go forward, have an idea in your head, but life has a different, you interact and there's different factors that will impact you. So just keep an open mind, because you may end up going down a different path, and that'll be okay. You'll figure it out as you go. So be open for new challenges and new opportunities, and just try it. If you don't like it, go back to where you were or regroup. So that's my advice.
And thank you for that, Melissa. And I would ask if you could raise your hand if your position actually requires you to be a registered dietitian, because not all of you are in positions that require that. So raise your hand if your position does require you to be a registered dietitian of our 5 speakers. Let's see, Christy.
Yes, so it does now. When I first started, I was just doing WIC services, and it was not part of my job description, but a year ago, I entered the role of WIC coordinator, and that does require you to be an RD.
Okay. Alyssa, does your position?
It does not. It's encouraged, but it was not a requirement.
Okay. Yeah, so of the 5, there's one who, because of the change in position, now does need to have that RD, but otherwise that RD is just, value added for who they work for. So others could be entering, these different fields of work. We have another question about what the job outlook, this is from Kylie, the job outlook for public health nutritionists. What would you say about that?
I think it's getting better. It's definitely improving. I think there's such a confusion on nutritionist versus dietitian, and are they needed? Can they be covered by nursing services and things like that? But I think that it's definitely improving, and there's more of recognition for nutritionists and dietetic degrees out there.
Other
Yeah.
thoughts
I would-
about that? Thank you, Alyssa.
I would agree to that. I think we're kind of shedding more light on the focus of preventative care and the focus on the importance of nutrition and dietetics. And so I just see it expanding.
And then this is to Sarah and Christy. How do you think your role as a dietitian or nutritionist impacts SNAP and WIC programs, respectively?
I guess I can say that especially the MPH program definitely helped me open my eyes, especially, I mean, one of my favorite classes was the PSE class, Policy Systems and Environmental Change. And it kind of just gives you an outlook on what is out there in the environment and how to better address some of these issues with, you know, with some of the clients that just don't have transportation or are very limited on their food resources. And that definitely helped me to tailor my cooking classes and just the educational resources as well.
So I would say as a dietitian, that knowledge is very helpful with providing services to WIC clients, especially the younger they are. Any kind of for medical formulas, when you have kids that have different kind of diagnoses, it's really nice to have that information and background. As far as having an NPH or having that knowledge that you get from your NPH, I would say I've learned a lot about health equity and social determinants of health, and that I don't know if it's changed the way I provide services. It's expanded my knowledge. I think I was aware, but I don't think I had a, kind of like I said earlier, I have tunnel vision. And so it gave me a broader idea of all the different things that go into helping the families that we serve and how to best serve them.
All right, thank you. So it is 10:59 and the clock will change here in just a little bit, but I wanted to note in the chat, we have Dr. Danielson encouraging everyone to register for the last seminar of the DPH seminar series. The title is The Role of Public Health in Our Lives Now and in the Future. The date is May 5th from 10 to 11 Central Time, and the Zoom link is in the chat. Again, I just want to thank the 5 speakers. I was so excited to have a public health nutrition spotlight for all of you. So thank you again for attending and for presenting, and have a wonderful rest of your day.
Thank you very much, everyone.